Well, our next speaker is going to be an interesting one as well. And this is on supporting healthy aging across the lifespan in terms of the role of the food industry. We have Dr. Tim Morck, who's with Spectrum Nutrition Consulting, to speak with us. For years, he's been with many companies in the food industry. Now he's the president and founder of Spectrum Nutrition Consulting, his firm that provides expertise in nutrition-related basic clinical research, product development, regulatory and also public policy, and global scientific affairs. And I've had many conversations with Dr. Morck, and they're always interesting and provocative, and I know you're going to enjoy having him talk with you. His unique multidisciplinary perspective really integrates science and business objectives with a passion for personalized approaches to improve health, and I know you're going to enjoy hearing him. Come on up, Tim, and tell us your wisdom.
Well, thank you for those kind words, Johanna. Obviously, I can't proofread because you'll see this is something I gave 2 years ago. But be that as it may. This was a rather, it sounded like a pretty simple topic, and then when you started thinking about it, it really became very complex. And I'm going to do a food macro perspective, and my colleague Duffy McKay will give the aspect of the dietary supplement role. So what I started out by thinking, well, for all of you, food industry, it sounds so glib. Well, what actually is the food industry? And when you start breaking it down into its varied components, you start to realize that it's not a homogeneous aspect at all. We have the commodity producers with the raw materials, you might say, farm fresh. We've got an organic component that's becoming very popular these days. And then you move into the processed or the packaged foods. And now, what about components of a meal, the frozen peas, the mashed potatoes, the things that are prepared and are packaged in a way that breakfast cereals, pastas, all these things. And along with that, you've got the sauces and the spreads and the dressings and the condiments and prepared dairy like cheese and yogurts and all of that. And so each of those industries really have for the most part, their own categorical products. And so when you say, what does the food industry contribute to healthy aging, it's really, what are you as a consumer choosing from this panoply of options to meet your own needs? I will point out that ingredient suppliers have a major role to play in this because they are the ones that are finding new opportunities. They're the ones that are capitalizing on some of the bioactives and some of the things, putting them into a form that you can actually add and enrich foods with things that we're finding might be of importance for the microbiome or whatever it might be. We also have the component entrees, the frozen dishes, the pizzas, handheld things. I mean, that's starting to be meals in a simpler fashion. But then there's the whole aspect of, let's say, desserts and snacks and salty chips and nuts and confections, baked in ice cream, baked goods, frozen desserts like ice cream. And obviously the hydration aspect, which we really just touched on briefly yesterday, is a very important one. And we have soft drinks, water, tea, coffee, juices, alcoholic beverages. We heard that you're allowed to have them in the dietary guidelines if you're of age. And then we're seeing all these fortified beverages and energy drinks and sport drinks. So, this is a big industry at large. And then you throw in a few now different wrinkles, the specially formulated products. So you've got portion-controlled meal replacements. These might be for weight control or for diet control. And they could be liquid or powders. The infant formula industry, which I'm very familiar with, some of the rest of you here are as well. That's a very specific formulation of meeting nutritional targets that have very specific requirements. And then there's food for special dietary use and even medical foods when, as Dr. Rubin was talking about, you've got special needs in the hospital or the non-healthy patient population. Now you throw into another mix of, well, what's popular in today's landscape? And you start thinking, well, we should be taking things out because we are told that they're not as healthy as we once thought. And so, yes, the dietary guidelines is giving direction about fat, trans fat, saturated fat, total added sugars. But what about gluten? What about, food allergies? Now people are looking for absences of those things. The dietary supplement aspect, as I mentioned, Duffy will cover, so I just put it on here because it falls under food as far as FDA regulations are concerned. It's considered food, not drugs. But now we've got a whole nother dimension, and this is the out-of-home food consumption. Quick serve restaurants, sit down, takeaway. These are a dimension of food intake which we have much less control or understanding of as we go out and make our meal choices off the menu. We don't, in most cases, know a lot about it. They're starting to have calories on menus. They're starting to talk about sodium levels. But for a large part of this, it's really, it's a black box and it's harder to manage. Then you got all the food service dimensions, hospitals, where there is more control, prisons, cafeterias, vending, and finally the government programs, which many of you are very familiar with, even the military. So, these all constitute the food industry. Well, one of the major trade associations for our industry is the Grocery Manufacturers of America. And I just put this slide up here, which you probably can't see very well, but talking about as the industry association, we don't just make food, we make time for families. They're talking about what the manufacturers do is they give you convenience and they give you the ability to not have to start from scratch to make your meals, and that gives you time in other ways. Safe, healthy, affordable food, very important. We take it for granted until you get a recall and you find out something was slipped through the cracks and now you have to recall it. We're providing more of the healthier product choices that consumers want than ever before, and this is really true. Over the last 5, 6, 10 years, we have been consciously as an industry reducing sodium, reducing calories, reducing fat, and so a lot of that is coming through now. And the second page talks about the healthy weight commitment, and I'll touch on that a little before, but these are commitments that are publicly made that the food industry is a participant in, and it holds them accountable and helps us see where we should be going. So just a quick slide on the restaurant industry. This is not a small potatoes, so to speak, industry. $783 billion industry. There's another part of this factoid that says that's larger than 90% of the world's gross national product of countries, when you think about it. So this is a big industry, of which now, in our current age, 47, close to 50% of our food dollar is spent in this out-of-home area, compared to only 25% back in 1955. And then there's a lot of details here. I guess my pointer finally gave out. So, yeah, I'm pressing, but anyhow, let's go back. Just to point out that consumers who order more 70% of consumers are ordering more healthful options in the restaurants than they did 2 years ago. So that's the trends are starting to be there, but there's also a lot of confusion, and some of the other numbers relate to that. Well, okay, so if the food industry is going to help in healthy aging and the nutrition, what drivers actually are impactful on the industry, and what do we need to think about? Well, obviously, the industry only sells products that people buy. If they don't buy them, they don't get back on the shelf, and they don't keep making them. So it is a consumer purchase-driven industry that has to have a satisfaction component to have resale. it's not that you just come out with healthy products because you think that would be a good thing if nobody likes them. And Campbell's Soup found out a very hard way some years ago with low sodium soups. People didn't buy them and they stopped making them. But another part of this industry is its incredible diversity. I mean, you go into the grocery store and there are some products that are life stage appropriate, the infant foods, I would say. But for the most part, there's no age specificity to the food. We see that if you're over 4 years old, you're supposed to be an adult by the dietary guidelines and all that. But there are meal occasions. There are breakfasts, there are dinner, there are lunches, there's all these things. So it's kind of types of foods. But now we're really faced with balancing familiarity. What did you have when you were a kid? What did your mom make at home? You know, what are you used to? What's the comfort foods that you turn to when you've had a bad day? Is it that half pint of Haagen-Dazs ice cream? I mean, you know, what is it that we don't eat typically to meet a physiologic requirement? We eat for social reasons. We eat for a lot of other things. Taste, convenience, cost. Cost is a big factor. Variety, ethnicity. And availability, by that I mean, can you get it at the store near your home? If you're in an inner city or an urban, how much flexibility do you actually have to make some of these choices? There's a regulatory component that I, near and dear to my heart, spent a lot of time in that area, but there are very clear guidelines on marketing, what you can say and cannot say, communications. There's a whole dimension of marketing to children, what's appropriate to talk about for children and what's not appropriate, what type of product should not be marketed to children. Labeling and claims. But the overarching commitment of the industry is safety, food safety, quality, and efficiency. The more they can have bigger plant runs, they can reduce the cost, and so cost is a big factor. So what we're seeing also, and talked with a couple of my colleagues, my industry colleagues here, the commitment to sustainable practices across the supply chain is now becoming more and more. And we saw that that was in the committee's recommendation for the dietary guidelines. It didn't quite make it into the final thing, a big part of sustainability. But for the industry at large, this is a big deal. Okay, so for the industry to provide nutritional support for healthy aging, what would we expect to see? Well, we need to see compelling research outcomes with practical applications, like we talked about yesterday, like we've talked about. The research, it drives what the efficacy or the value could be for making these recommendations. We need translational innovation with suppliers, and then from that, we're very happy to develop products or programs consistent with the research if we can talk about it, if we can tell people that that research outcome is something you might expect if you take this product or this food pattern. And I think that's an important component. New tools to identify and target susceptible individuals. How do we personalize this for your microbiome, for your disease state, for your predisposition, and your healthy aging? Cooperative and collaborative regulatory agency that sees that they can partner with us, not just be against us in trying to come out with food-based solutions and appropriate data. I was happy to hear that physicians really need to incorporate this, and we need to include them in this dialogue, and education, and how do we get endorsement of these nutritional concepts by regulators and physicians when they're shown to be therapeutic for patients, and this might be more in the end stage as well. Effective use of social media, technology to bring about messaging, this is a very important part. Right now, we have health claims as part of the regulatory thing, and these are for preventing risk factors or reducing risk factors of future chronic disease. And you know, there's about 18 or so of these, and they're pretty general, eating more fruits and vegetables, you know. And so from there, we're getting into qualified health claims, which are a little bit more aggressive, but don't have as much strength of the evidence. And so, to be honest, the complexity of the language you have to use is so obtuse that very few companies decide to put it on their package after all. But we have made a lot of progress. We've reduced fat, calories, eliminated trans fats pretty much out of the food supply. Adding fiber, a lot of whole grains are coming in. We've increased protein. Omega-3 fatty acids are being added in foods and areas, probiotics, iron. And, in some areas, early stage formulations to hydrolyze proteins to reduce the allergic potential in infants with cow's milk allergy, and medical foods for patients that are unable to consume food in the normal fashion. This is just a slide of the Healthy Weight Commitment Foundation that I put up here. And this is really an interesting aspect. I put it here because pretty much all of the food industry, large companies, are partners with this. There are over 300 partners. And this isn't just about a food program. This is about going into communities, talking with educators, physical activity, working with coaches and life skill so that there are benefits made at the community level. But the slide on the right just shows that there was a target of taking 1.5 trillion calories out of the food supply. Well, we actually have, in the last calculation, it's up like 6.4 trillion calories have been taken out because of commitments that were made. So in summary, what can the food industry do? Well, I think we can promote, we can support best research practices to establish those links of nutrition and healthy aging at all stages of life. Industry does fund research. They partner with academics. They do a lot. It's getting harder because of various perceptions of industry-funded research. I won't go into that, but the research and the data is just as important for us as it is for the science community. Develop and market products consistent with nutritional recommendations. Now, this is a little more challenging because, as Eve was saying, we're talking about patterns. So it's not just this breakfast cereal is good for you, or it's how do you select from the panoply of products, diets that are consistent with the Mediterranean diet, the DASH diet, things like that. That's a bigger challenge. But we can collaborate with regulatory agencies on effective ways to communicate the value of individual products or collective groups of products. And then finally, partnering with industry, scientific, academic, government organizations. I think we do. Many of us have done this and have components as companies, but we could do it in a more collective way to increase the awareness, the value, and the vital role that we have in promoting healthy aging. So, thank you.